Hi there, I'm Dr. Rezan. I'm a family and sports medicine doctor here to talk about what to do if you're a medical scribe for a patient with cough and or sinusitis. So understand that I'm giving you general tips. Please refer to your particular doctor to decide on the details. And this is a general course. Obviously, anything I say right now is not intended to be medical treatment. And it's important that you vary this compared on your particular situation. So cough is a very common symptom that presents to a doctor's office. It can have multiple causes: upper respiratory infections such as viral, bacterial, and or fungal. A lot of times it can be due to sinusitis, bronchitis, even pneumonia, and sometimes it can have a mechanical thing such as irritation of the throat and or even irritation of the tympanic membrane. Physical exam, there's tenderness to the frontal and maxillary sinuses. The lungs are usually clear and they might have purulent drainage. Testing is usually minimal for sinusitis. You might culture the nose. If they're refractory, they may order a coronal CT scan, which is a scan sideways of the sinuses, and rarely these days do we do sinus x-rays. The treatment is to encourage good hydration, especially hot showers. You can use a mist type tent like this lady's doing. You can use mucolytics, nasal sprays, antibiotics, and or steroids. So the plan is to encourage the patient to have good hydration as well as frequent showers. Possibly consider nasal sprays such as over-the-counter Afrin. You can use Mucinex to thin the secretions. And if appropriate, use antibiotics such as Keflex, amoxicillin, Augmentin, Bioxin, and Cipro. And in very severe cases, they might even use steroids, either Medrol dose pack or the like. For patient education, we encourage them to let us know if they're not better in 3 to 4 days, to use a vaporizer, increase their fluids, obviously avoid smoking, and be wary of rebound congestion after you stop using Afrin. So in actual documentation, you want to document in the chief complaint what are the symptoms such as cough, congestion, fever, fatigue, and then the duration of how long they've had the symptoms. A typical template for this symptom might be the one that you see here, where the patient is a such and such year old, male or female, presents for cough and sinus pressure for how many days. And then you can go through all of the different questions to ask. If there's any pain, you want to give it in a pain scale of 0 to 10, 10 being the worst pain you've ever had in your life, and then you can do it at rest and with activity. And you also want to see if they have had any underlying type symptoms from before, as well as what medications, what treatments have they already tried? Have they tried over-the-counter medicines or prescriptions? And are they up to date on their flu shot? On the history of the present illness template, you look at the past medical family social history. You can do their past medical history that they have, medications that they've used that are baseline, not necessarily for this treatment, but ones they've used. They have to be on like blood pressure medicine or cholesterol medicine. Are they a tobacco smoker? If so, quantitate. Get how many pack years they're in. So packs per day times the years. And then I always like to ask about exercise, nutrition, and sleep. I like to ask about review of symptoms to remind the patient to tell us all their symptoms so you can quickly go through this, especially constitutional symptoms. I like to know, since the last visit, has my patient lost weight or gained weight? And then they have skin, eyes, ears, nose, and throat, lung, heart. Do they have any musculoskeletal, neurologic, endocrinologic, or allergy type symptoms? On the physical exam, this is a typical template you might use. You can do a general situation on the patient. This is not an unreasonable sort of physical exam. Usually, again, the lungs are clear unless they have something that is going on within the lungs. And then you can go through this and quickly decide on your assessment, do they have a medical decision where they need antibiotics or they don't need antibiotics? If it's viral, you don't need antibiotics, and they will not use them for viral syndromes. But if they are having something that is indication of a bacterial process, then you can use antibiotics. Finally, these are the kind of ICD-10 codes you might use, such as an R code, which is a symptom code, so R05 is for cough. Otherwise, you can use the appropriate examination diagnosis. Plan and treatment, increase hydration. You can use over-the-counter Tylenol and ibuprofen. And these are the typical antibiotics you might use for sinusitis if you deem it necessary. In very rare cases, you can use nasal sprays, steroids, and again, if it's really bad, you can use they might order a CT scan or an ENT consultation. So pearls and pitfalls of medical scribing for cough and sinusitis. It's good to document the duration of symptoms, what previous treatments they've had, as well are they allergic to anything, especially are there any medicines they may be allergic to that we should not prescribe for them. So your takeaway point is cough is very common. Attempt to determine the etiology of the cough. The doctor will want to know what over-the-counter medications and prescriptions they've used for this. Understand that with upper respiratory infections, we do not use antibiotics. And the doctor, if he does use antibiotics, will usually need to document the why of using the antibiotics and give justifications for that. We hope this was helpful. And again, thank you for all you do, because while doctors save lives, you scribe save doctors. Thank you.